I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're going to go over what's causing your shoulder pain. And I want to say, before we begin, I need to kind of caveat this with, generally, it's not one thing. So we're going to go over several tests tonight that you can do at home to kind of make a differentiation on what's going on with your shoulder, but a lot of times it's not just one thing. And what happens is people ignore the little signs that when they should be treated, they kind of brush them off. Like maybe it hurts to put your jacket on. Maybe it hurts just to reach into the back seat. But guess what? You can turn your body and you can reach into the back seat, or you can just turn your shoulder and get your arm in your coat without having it to really affect anything going on in your everyday life. So you make adjustments for things and you change how you do things, which then in turn allows you to be able to function for longer and not have to deal with the problem. But eventually what you find is maybe it starts to hurt while you're sleeping now, and now it's hurting when it's overhead, and you can't do everything you want to do at the gym, and it really snowballs. And the more and more you ignore it and the longer you allow it to snowball, the worse it's going to get and the more problems you're going to have. And so that's why it's really important to understand that while you might do these tests, you may be able to fit yourself into all of these categories depending on how long you've let this go. So it's one of those things where, just take this with a grain of salt. I am going to show you some things, and if you wind up with getting positive tests for all of these, you really need to be treated, and you should have been treated a long time ago. There's nothing really at home that I can say, yeah, let's do that, and that's going to help. It's going to be more of a hands-on approach. We need to get in there and really fix all the dysfunction that's going on. So the first thing we're going to go through is called a Ruse test, and it's called Thoracic outlet syndrome. And this is something, if you determine that you have it, not a lot you can do at home for it. Some posture-related stuff that you can fix, but you really need to get in and get treated because it is affecting the nerves, and you want to make sure that you're able to recover. And then the worse you let this get, you actually can lose strength in your fingers, strength in your hands, begin to drop things. So you're going to start with your arms out, elbows up at 90 degrees, hands like this, and all it is just this, okay? You're just making a fist, okay? You want to make sure that you're not dropping below here, okay? And you want to make sure your fingers are up, and you want to make sure that you do this for 3 minutes. Now you're looking for numbness and tingling. Every time I've seen this test, honestly, within like the first minute, somebody goes numb, has numbness and tingling. Most people who have thoracic outlet do not make it to 3 minutes doing this. Some of you may fatigue. Some of you may get burning in these muscles if you're not working out or you're not used to holding your arms up. Some of you may get just some pain in your fingers from doing this for 3 minutes. But we're looking for numbness and tingling. That's really the caveat. That's a positive test. Other symptoms, pain, uncomfortable, that's not indicative of that you have thoracic outlet syndrome. It's really just this, and you're going to get some numbness and tingling. The second thing we're going to go through is, it's called the empty can test. This is going to test a specific muscle of the rotator cuff to see if there's a possible tear there. And all you're going to do is you're not going to go straight out, you're not going to go out to the side, but you go out on a 45-degree angle. And what you want to do is you just want to turn your thumb down so it's facing you, and you're just going to raise up, nice and easy. You don't want to go past 90 degrees, you're not going to go all the way up here. It's going to hurt up here. I don't care if you have a healthy shoulder or not. If your thumb's down and you're all the way up here, it most likely is going to hurt. So you stop at 90 degrees, but you just want to go up and down nice and slow, all right? This is going to show that there's a problem with the supraspinatus muscle, which is part of your rotator cuff. If you wind up getting a positive test, a lot of people have a lot of pain, a lot of people can't even do it. You need to seek some treatment for that. It could just be inflammation that we can knock out pretty quickly, but this is definitely a sign that there is a problem there with one of the muscles of the rotator cuff. The next one is a painful arc. So you're going to have your thumb up this time, and you're just going to raise it up overhead, nice and easy. So this is testing for tendinitis. Now, the one thing about tendinitis that you have to understand is that tendinitis has multiple causes. So there's really a lot of issues going on with your shoulder, but this just means that there's an inflamed tendon, and all you're going to do is raise it up. And what will happen is, it's going to be great, 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 ow, 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 ow. Okay, so that's why we call it the painful arc. Right about here to here, it's going to be painful. Once you get up here, feels great. Down here, totally fine. In here, hurts, okay? that's the sign that there's inflammation going on. If this is the only test that's positive, this is a great time to get it treated because it means there's not a whole lot going on. You do have tendinitis, but the rest of your shoulder is intact. You haven't really torn anything yet. That's substantial. There might be a small tear in there, but you're able to do this, and this is just painful. That we can treat that pretty quickly. It's just a matter of correcting shoulder muscle imbalances in your shoulder. And then the final test you're going to want to do is for impingement, and a lot of this goes hands in hand with tendinitis, and then this actually leads to a rotator cuff tear. So if you test positive for this, this is something you really want to get checked out, really want to get treated, because the next step beyond impingement is a rotator cuff tear. So this is kind of the forewarning of the cuff tear. It means that one of your muscles are getting pinched, which is part of the rotator cuff, and will eventually become a tear if it's left untreated. So all you're going to do is take your hand, rest it on the opposite shoulder, and all you want to do is lift up. Use your opposite hand to lift up your shoulder, okay? Don't lift it up like this, all right? Just use your opposite hand to lift it up and lower it. If you get pain, that's positive for impingement. Again, it's something that it means there's an inflammation going on, the muscle's being pinched. The muscle gets pinched enough, it becomes a tear. That's how the rotator cuff tear starts. So those are just a couple of quick, simple tests you can do at home in order to be able to determine what the exact cause of your shoulder pain is. If you don't test positive to any of those, there are some more complex tests that are a little bit harder to do on your own at home. Just because those four were not positive doesn't mean that you don't have a shoulder issue. It just means that those four things that are easy and quick to test at home were not what you have.